Okay, well here we are in our theater. It's a very busy place, a lot of activity going on, people coming and going, and effectively what happens is that the patient comes down to theaters, okay? They're going to come down this corridor and they're going to run down here. This is the usual sort of routine for patients. They're going to come down here. Now bear in mind, these are our existing theaters. We're actually going to be getting brand new theaters in the coming 12 to 18 months. So that's obviously nothing. But at the moment, patients walking down this corridor to get into the anesthetic room where they're going to be going to sleep. Come this way, I'll show you. Okay? This is our anesthetic room. This is where our patients would go to sleep. And over here, right across, is theater 4, as you can see. And this is where all the operating is going to be taking place. But I'll show you that in a second. But let's pop into the anesthetic room so people know what the anesthetic room is all about. Okay? And what we got here is we got one of our anesthetists, David Lomax. Hello. So this is David, and we've been working with David for a long, long time here. How was it, over 15 years? Is it? Must be at least 15 years. Yeah. And David is a really important part of the team here because, as you can understand, this is the person that's going to put you to sleep. Okay, he's going to look after you whilst I'm doing the operating. So a lot of patients, David, are very worried about anesthetics, right? There's a big myth around it, right? They're not sure what to expect. They're worried about not waking up, which is obviously one of the big things. And I've always said that you guys, as anesthetists, as a group, have to work on your PR because people, you ask them, what are you worried about? Are you worried about the operation or are you worried about the anesthetic? They always say it's the anesthetic that they're worried about. What would you say to a patient who says, oh, I'm worried about the anesthetic?
Well, I just say, it's quite normal to be anxious about anaesthesia. You will wake up, everybody wakes up. I think it's quite normal. It's the fear of the unknown. But it is, it's very safe. So you come in here, have a little bit of something to help relax.
Yep, we'll get you on this trolley, get you as comfortable as you can be on a trolley because, sure, it's not exactly the most comfiest of beds, but hey, it does the trick, right?
Yeah. And then we put some monitoring on, which is the monitor above the machine there. Okay. And then the anaesthetic happens in here.
So so just to make it clear, they actually go to sleep here, right?
Yes,
Before they go, so they don't actually see the actual theatre. No. Because they're asleep for it. So I think that's an important little thing for people to understand. They won't see any of the stuff that's going on in theatre, so they have to worry or get anxious about that. The other thing I get a lot of patients asking me, say, can I have it under local anaesthetic instead, instead of a general anesthetic? Why do I have to have a general anesthetic? I mean, I've always said to them, you know what, I think, personally, I think a general anesthetic is probably a little bit safer because when you have a local anesthetic with some sedation, which is making you a little bit drowsy, so you're not really aware of it, you're not fully asleep, right?
No, that's right. I mean, a lot of people just prefer the sound of sedation, I think, over anesthesia.
It's lighter, isn't it? Yeah.
The drugs are very similar, and it's really just a degree of how much is given. So some of the drugs are very similar. So really, if you're going to have enough sedation drugs to actually go to sleep, you're anaesthetised anyway.
Yes, that's right. I mean, but I suppose with the disadvantage that you're actually not hooked up to the machines, are you?
Yeah. Well, you can have some monitoring, but by and large, there's not as much control from our point of view.
Sure.
I mean, I think if you ask most anaesthetists, they'd rather someone had an anaesthetic. There's much more control. Oxygen delivery is safer and it's more controlled. So.
I suppose you can't forget to breathe right that way when you're under the monitoring of the anaesthetist.
Yeah, exactly. It depends on the procedure, but by and large, I would much rather do an anaesthetic. I think it's safer personally. But there's some minor procedures where sedation can be used.
Sure, of course. Very short procedures.
I think if you ask a lot of surgeons, they prefer anaesthesia because the patient's more relaxed. The muscles are more relaxed. I don't know the mind.
Well, it's also a very interesting thing because from my point of view, obviously, I don't want patients flinching when I'm actually doing anything, right? Because for me, I want to know that the patient is asleep, is comfortable, he's not feeling anything, so that I can get on and do my operation. Because if I worry, I'm going to hurt the patient, so maybe I back off a little bit, I'm not putting my fullest into the procedure. So. From my point of view, I think it's always better to have a quiet, asleep patient. Now, the other thing, of course, that a lot of patients are worried about is feeling sick afterwards, right? And I always tell them, it's possible, but modern anesthesia these days has come a long way, hasn't it?
Yeah, and it's still possible, even with all that. I mean, overall, about a quarter of patients probably are a little bit nauseous after surgery. We can reduce that with anti-sickness medications, and we do that routinely here, so everybody gets that, and there's some written up for afterwards. But I think on what we do here the risks of nausea are quite low, but it's still there. But, I'd say, what would you think, about 5%?
Yeah, I certainly don't get too many patients.
It's 1 in 20 perhaps with nausea, so it is quite.
And of course, this brings us on to the post-operative period, because the other thing they worry about is, am I going to be in a lot of pain? And again, the procedures that we do, at least, they are not quite as sort of what I would say deep operations, really involving a lot of muscle cutting, which usually involves a lot of pain as well. Ours is a bit more superficial around the skin, maybe the fat. Maybe we deal with a little bit of the muscle, but in general, patients are actually not that bad. And obviously, you play a big role because you control the pain relief afterwards, right?
Yeah, no, that's right. No, you're right. The pain levels are quite low. We can treat that in recovery if we need to. With
and of course, that helps for sickness, right? Because you have to give really heavy.
It does, yeah. I mean, one of the main causes of sickness are the strong painkillers.
Yeah,
so
that's right.
Morphines are one of the main reasons. So we do try and keep those to a minimum.
Yeah.
But what I say to everybody is, if you need something, you will get the stronger painkillers. Obviously, if it's there, but we try and make do with simpler painkillers. And most of the procedures we do here, simple painkillers are enough. But we do have the extra stronger.
I mean, I've had a lot of patients afterwards. Okay, apart from the first few hours where they're a little bit sort of sore, and they take something, they say, you know what? After the next day or two, I don't actually take any painkillers, which is quite good, Or maybe they take the old paracetamol,
Well, we do give patients painkillers to take
yes, of course we do.
So they're there if they need them. But as you say, probably a day or two at the most.
Interesting. The other thing that causes going back to sickness is antibiotics. Okay, because antibiotics can actually, and again, we minimize the need for post-operative antibiotics a lot. We give you some antibiotics during the operation to cover you, of course. But in general, when you reduce the excess antibiotics, then patients don't feel sickness as well. So this is the man. This is the main man, certainly from the anesthetic point of view, keeping you safe. Obviously, I do the procedure, but yeah, this is basically the environment. So I just want to show everybody where it was like.